Hello, I am Dr. J.V. Srinivas, Lead Senior Consultant at Aster RV Hospital, JP Nagar, Bangalore. Today we are talking about joint replacement surgeries. Why Aster RV Hospital for a joint replacement surgery? I will highlight some points which will help you to decide. Aster RV Hospital Department of Orthopaedics, we started in 2019 April. It is approximately 6 years ago. Last 6 years, we have performed more than 4,000 joint replacement surgeries. In my personal experience, I have conducted more than 13,000 joint replacement surgeries, and with a unique focus on joint replacement surgery, I moved to this hospital. Today, a joint replacement surgery is a very successful program at this hospital, and we are launching Aster Institute of Advanced Orthopaedics and Robotic Surgery. So what we have noticed here, joint replacement surgery is not a one person's game or a one surgeon's skill. It is an overall care for the patient. First of all, the surgical team should be well equipped and well trained. At Aster RV Hospital, under my leadership, we have 9 surgeons who work together for a single patient to make sure you get the best of this skill for that surgery. It can be a total knee replacement or a shoulder replacement. Also, sometimes we do elbow replacement. These are the areas where we do joint replacement program. We can handle primary surgeries, we can handle complex surgeries, we can handle revision surgery. Revision means surgery done elsewhere. It requires a change or revise the entire unit, and we are capable of doing that because our surgical skill is adequate and well exposed. We do have a training program here, and people from all over the country come here for a 6 months fellowship to learn our surgical skill. Second, it's a teamwork, as I said. We have the best of the anesthesia team here, irrespective of the medical condition patient is having. For most of these patients are senior citizens. They might have cardiac problems. They can have pulmonary problems, uncontrolled diabetes, hypertension, hypothyroid. Irrespective of any medical condition, we have a great anesthesia team. They optimize the entire situation, medical condition for these patients, and then they take up for the surgery and make sure the post-operative period patient is completely pain-free, because the anesthesia department is so well equipped that post-operative pain control is excellent here. Patient is very happy throughout the stay at this hospital. The third more important is the nursing care and the physiotherapy. Physiotherapy is a very important part of any joint replacement surgery program. We have one of the best physiotherapy team here, and they do a good programmed physiotherapy for all these joint replacement patients. Not only in-house, as far as they are staying at the hospital, we do an in-house physiotherapy program, and once they go home, the same team continues there at their residence, the same physiotherapy team, and that will be a continuation of physiotherapy, and that ends until the patient is completely pain-free, is able to walk, and patient is very happy till the surgery. Till then, we do the rehabilitation program. Then, technology-wise, if you see the implants, conventional stainless steel implants which is available, which gives you a life of 10 to 15 years. At Aster RV, this is the only hospital in South India which can give you a high-end or high-performance bearing joints. These are called ceramic knees or oxenium knees. What I perform is Journey to BCS Oxenium. That's the most advanced knee implant available in the market today, and this is available only in our hospital, I can confidently tell. Usually this gives a life of 25 to 30 years. So using this implant with the robotic technology, all these patients can have a completely pain-free joints for next 30 years. This is the implant. Then the new technology what we have procured is robotics and artificial intelligence. Robotics is used in primary knee replacement, revision knee replacement, partial knee replacement, and total hip replacement. This is what the areas robotics have come into picture, and this is definitely helping the surgical team to put the implants in an accurate position so that the patient's rehabilitation is faster, completely pain-free post-operative period, and also the longevity of the implant increases. The last and the most important point for our society is the cost. By giving so much, are we really charging them huge money? No. We want to keep our costing very nominal so that most of our patients, whether it's a middle class, upper middle class, rich class, or a lower middle class also, should be able to afford this kind of services at our hospital. We have positioned in such a way that prices are very, very nominal. Most of the patients comfortably they can come here and avail the treatment, avail the services what we give, and have the best surgeries at our center, that is Aster Institute of Advanced Orthopaedics and Robotic Surgery. Thank you.